This is Dr. Raj, your host of the Weekend Warrior Show with Jani Moon. I'm here to treat your joints and your sports injuries and prevent you from having unnecessary operations. Obesity epidemics have created a media frenzy of diet fads, which have ended lives. I mean, people have lost their lives because of obesity indirectly, because all of these companies and pharmaceutical companies are coming out with medications like Fen-Phen and Xanthrex, and we're talking about fragile people. When you are obese, you're overloading your systems, you're overloading your heart, you've got clogged arteries, you've got visceral fat, you're not cardiovascular, is compromised, and you start giving someone a stimulant of this nature, you're taking a huge risk. I mean, even when I do surgeries, when I have someone who has excess weight, it's a big risk. I mean, we don't take it lightly. I had a client recently that simply just pushing on her stomach, just put pressure on her lungs and compromised her breathing. I mean, nothing happened to her. That gives you an idea. Things we can normally do on most people, we've got to be extra cautious on someone who has increased weight. What do you think about that, Jani? I mean, with all these medications, the Fen-Phen, the diet fads, the juicing diets, I think they're all BS.
They're all BS. Diets don't work. Eating a clean, whole food diet, we know now. All the hype, no fats, no sugars, no calories. All of it's BS. We got to go back to caveman village times when we were on and connected to the land.
Paleo. Yes.
Paleo. Yeah. I mean, I mean, there's so many words like paleo, but it's a whole green diet. It's just the way we used to eat. But I'm curious because I know we have Barbie. Barbie, is that how you say your name on the line?
Yes, Barbie.
Hey, Barbie, how are you today?
Oh, I'm doing okay. I had a question. It's not about weight. Luckily, I am not overweight, but I did, back in 2002, I tore my patella and my meniscus, and I had to have knee surgery. And in September, I fell again, and and I tore my meniscus again, and I was just wondering what your thoughts were about waiting to see if it might heal on its own enough to not have to have surgery, or I should have surgery sooner than later, or what basically your thoughts were on that.
So my thoughts right offhand. How old are you, Barbie?
I'm 41.
41. So here's my worry. Almost a decade ago, you sustained a horrific injury to your knee, which caused you to tear your meniscus, also your patella tendon. I mean, that in itself, that trauma in itself is huge. With that trauma, the trauma to tear a meniscus in your early 30s or, late 20s is a significant enough trauma that will cause joint damage. So when you fell and hit yourself and damaged, invariably you bruised or damaged your cartilage. Now, this recent fall, is there any reason you want to wait? Are you scared or?
Well, I have a autoimmune disease called reflex sympathetic dystrophy. So surgery, at the time I injured my knee the first time, I didn't have that, and now I do. And so I'm afraid of surgery to exacerbate the RSD.
Okay. Did you have RSD after the you had RSD after the first operation, correct?
After.
Or you did after, okay.
Yes.
That's a tricky scenario, and now I get you. I thought at first you were just afraid of doctors and surgeons.
No, I think
because they're so scary.
What?
Yeah.
It is scary. Actually, you know what RSD is? RSD is basically on a simplistic basis when your nerves start overfiring. So you have this pain that's out of proportion. And there's people, Jani and Barbie, who actually end up having horrific complications from it, inclusive of potential amputations in early years. Now we've got different technology to deal with it. But is your knee locking or giving way, Barbie?
It is locking, and especially on stairs, it's very painful.
Okay. Recommendation right offhand. Number one, you do need to see an orthopedist, because if you have a knee that's locking and painful, it means that meniscus tear is scratching that cartilage away. And that cartilage is probably not the best after your injury. Number two, I want to alleviate your fears to a degree. The reason why your RSD was probably more significant in your first injury is because it involved two different aspects. Now, if you just have a meniscal tear, I'll be honest with you, like these type of surgeries now, we can do it under local anesthetic. I did one Friday. That took me 8 minutes. So it's not, it's very minimally invasive. So I would definitely do your research. Go to someone who has done a lot of them, or who has a happy waiting room and a busy waiting room, and then just jump on it now versus waiting.
Okay.
Do you think you can do that, Barbie? How does that sound to you?
Well, I'm a little scared, but like you said, I'll find a doctor in my area. I'm in Arizona who
what are you scared about? What is this? What's scary about it?
I'm scared that the RSD will spread further and cause more damage to me. So I'm a little worried about that.
Barbie, what do you do for a living? Are you a mom? Do you have kids? Do you work?
No, I don't have kids, and for a living, I work with a nonprofit charity, and I also am an author.
Oh, wow.
Oh, wonderful. What's the nonprofit?
It's called Power of Pain Foundation, and I work with pain patients to help them have better daily living. And
oh, my gosh, and you suffer from pain. That's crazy.
Yeah. So I try to use my story as a motivational story, and I try to avoid injury at all costs, but I basically walked off of an edge of a stage. I thought that I didn't see the edge, and I just walked off and landed on my knees. And that's how I ended myself. Yeah, so I try to be motivational and inspirational for other patients, but right now I have to kind of deal with my own injury.
Well, what's the most motivational thing you can say to yourself if you were one of your patients? What would you tell your patient who is in a similar situation as you?
I would say be your own best advocate and stand up for yourself. Do your research and know before you do something, be comfortable with it.
Yay!
I love that. That's perfect, actually, Barb, because in the end of the day, if you don't have full comfort in your decision, don't jump on it, especially when it comes to your body and health.
Okay.
You're your own best advocate, Barbie.
Thank you. Yeah, take my own advice, right?
Exactly. Amen. A woman.
You're working your steps right now. I love it. So
thank you.
You'll be fine. You'll be fine. But just find someone who does it. Find someone who has the comfort. I've operated on people with RSD before, and it's worked out perfectly on a minimally invasive. I just prepared everything. And we were all prepared, and we mitigated our potential damages or potential negative effects and created a positive environment. So
best of luck to you, Barbie.
Thank you. Thank you so much, you guys.
Bye.
Bye, Barbie. So, Jani, this is like this whole obesity. Actually, that was a great story because the psychology of all of this, Barbie's her managing this, the psychology of pain. In the same way, people are addicted to, feeling good, and they look for quick ways to feel good. Quick, easy ways. And one of the quickest, easy ways are sugars. Like the foods have more sugar than they did before. And this is a secret trick that the media plays with us, that companies play with us, commercialism, to make us eat more.
We're being self-medicated secretly, covertly, with sugar, and we don't even know it because it's in everything. It's in everything. Like, I love mango slices, and I'm looking on the back of the package, all this freaking sugar. I'm like, why do you have to put extra sugar on mango slices? It's ridiculous.
I know, it's crazy. Well, you know, in our next segment, we are definitely going to talk about fen-phen, the Xanthrax, and how these medications have killed people and for the sake of trying to lose weight. So silly, and this drives me nuts. So stay tuned for our next segment.